A faint line on a pregnancy test. You have done the pregnancy test and you have seen a faint line and you are asking yourself, what could this mean? Tugenda kwogera ku oba okoze test ey'olubuto n'olaba akali ka line aka testing ak'olubuto nga kabadde kali faint, kikyenyini kyekitegeeza oba okalaba ka line ako nga kasaze naye nga tekasaze bulungi. A faint line on a pregnancy test. Gerard Massa, the health educator, is the name of the channel. If it's your first time on this channel, you are most welcome. Remember, on this channel, we do create awareness about fertility and reproductive health. A faint line on a pregnancy test, what does it mean? So, if you have done the pregnancy test, because first of all, we shall begin by understanding and talking about the different types of pregnancy tests. There is one known as the urine HCG pregnancy test. In this test, specifically a very small sample of your urine is got in a small container given to you by your doctor, and then there's a testing strip. It's called the HCG pregnancy testing strip. Is used to really detect for the levels of the HCG hormone, and specifically when the levels of the HCG hormone are high, or when we see two thick lines, then this is a confirmation that you could be pregnant. Next pregnancy test is where we look at the levels of the hormone for pregnancy, also known as the beta HCG levels in your blood. It is known as the serum HCG pregnancy test. Serum means a small sample of your blood, known as whole blood, is got by getting a small syringe injected, collecting the sample using a small syringe, and then this blood is prepared in the lab by use of a machine also known as a centrifuge, and then after preparation of this small sample of blood in a purple top container, the tests can be done to look for the pregnancy hormone in your urine. Specifically, this is one of the most key important tests for testing for pregnancy. It is the second type of test, and we've said that it is known as the serum HCG pregnancy test. And then lastly, we have what we call the obstetric or pelvic ultrasound scan, whereby also pregnancy can be assessed if at all it is between 3 weeks or if at all it is above 3 weeks. There, if at all you do the ultrasound scan, your doctor will be able to look at the changes happening inside your womb. These are known as decidual changes. Tugambye nti waliwo tests ez'enjawulo ez'okukebera olubuto. Test esooka yeno gye tuyita the urine HCG pregnancy test. Mu test eno gye tuyise urine HCG pregnancy test, omusulo dokita wo ajja kuba akuwa akacupa ogendo gye ko omusulo, and then of course ajja kuba akola test eyo mu laboratory mwe bakeberera, ajja kuba akebera, and then of course ajja kuba alaba akantu kaba kasaze obulayini obubiri ke bayita strip, kajja kuba kakonfaminga nti wandibanga oli lubuto oba wandibanga oli lubuto, and then woba okoze test ey'okubiri gye tuyita the serum HCG pregnancy test. Mu test eno specifically ekigenda mu maaso kiri nti baba bakebera olubuto naye nga bakozesa omusaayi, ng'era bakebera nga bacekinga hormone eno gye tuyise the serum HCG levels. Test eno y'omusaayi nnungi nnyo kuba esobola okulaba olubuto newankubadde nga lubadde luli lwa nnaku 2 oba nnaku 3 oba actually n'ennaku 5 ebe esobola okulaba obulungi, kuba levels zetandikirako okulaba olubuto zirina kuba nga ziri 5 mil international units per mil. So weziba ziri below 5 lwandibanga olubuto lukyali luto oba luli mu lunaku lumu. Tuli kwogera ku tests eza pregnancy, tuli kwogera ku faint line pregnancy test. Okoze test naye nga ate kalayini kasaze ate nga kali very faint. What is the cause of this? Tugambye nti ate waliwo ne scan oba testing ey'olubuto nga tukozesa scan gye tuyise pelvic oba obstetric ultrasound scan. Dokita wo aba asobola okukola scan eno n'akubuulira biki ebigenda mu maaso mu abaana oba olubuto mweruli oba temuli. Jjukira scan eraba olubuto ng'etandikira ku at least 3 weeks oba weeks 3 okweyongerayo. A faint line on a pregnancy test. What are the causes of a faint line on a pregnancy test? Welcome to our channel, and remember to subscribe so that you do not miss videos we release every day about pregnancy, about fertility and reproductive health. So we have said, we've talked so far, we've talked about the different types of pregnancy tests. which can be done. The first one is the urine HCG pregnancy test, and we've said that there's also one known as the serum HCG pregnancy test, and then lastly the pelvic ultrasound scan for testing for pregnancy. Remember, for the pelvic ultrasound scan, the pregnancy should be 3 weeks and beyond. If at all the pregnancy is below 3 weeks, then there are high chances that the scan may not be able to detect the pregnancy, because specifically it begins as a small reaction inside the womb. If at all this is the lining of the womb, and then this is the outer lining, or the innermost lining, also known as the endometrium, where the baby is going to come, or where the fertilized egg, also known as a blastocyst, is going to come and implant itself or attach itself. The ultrasound scan is going to specifically see what we call the decidual changes. There's going to be a small reaction happening. It may not see a lot, unless at all your ultrasound scan doctor is really experienced. They can be able to detect that this could be a pregnancy. Remember, in this video, we are talking about a faint line on a pregnancy test. We've given a whole brief about pregnancy testing. We've talked about the different types of pregnancy tests. We shall go to the key or to the main topic for today, and we have said that pregnancy tests are really very effective, but whenever you do the pregnancy test and then you see a faint line, this could indicate that there are some issues that are happening. Maybe you could have tested very early. Maybe you used a container which had lots of water and the urine was diluted, and thereby the levels of the HCG were low. Or maybe you even did the tests very early when the levels of the HCG hormone were still low. Tugambye nti ebisobola okubanga biviirako test eno eya pregnancy okubanga ebeera very faint, kiyinza okubanga okebedde mangu olubuto ng'ate lubadde terunatandika kufominga bulungi, oba n'ekirala oyinza okubanga okozeseza container, bayinza okuba bakwadde ka container ak'omusulo naye ng'ate kabaddemu amazzi tebakategese bulungi, naawe n'oteekamu akasulo katini, then ogenda okulaba nga tekalaze bulungi. And then tugambye nti wandibanga oba okoze scan oyinza okuba nga ogikoze naye ng'ate obudde bw'ogikoleddeko olubuto olubadde terunaweza weeks esatu, 3 weeks. So we are proceeding with a faint line on a pregnancy test. Whenever you see a faint line on a pregnancy test, please, you should not worry, you should not stress yourself. The best advice I can give you is that if you are really very anxious and you would like to maybe confirm whether you are pregnant or not, you can go on and do the serum HCG pregnancy test, or the pregnancy test where they will check for the pregnancy hormone using your whole blood. The test is known as the serum HCG pregnancy test. And if you still have doubts and you are really so anxious and you would like to add more tests, you would like to do more tests, then you can do what we call the pelvic ultrasound scan. The pelvic ultrasound scan will be able to tell us whether you are pregnant, and it will also be able to pinpoint or to tell us whether your pregnancy is inside the uterus or it is outside the uterus. If it is inside the uterus, we call it an intrauterine pregnancy, abbreviated as an IUP. You may do the ultrasound scan and you could see that in the conclusion made by your doctor, concluding that IUP present. It means intrauterine pregnancy. If the pregnancy is outside, we call that an extrauterine pregnancy, also known as an ectopic pregnancy. It's always an emergency. Remember, we've talked about ectopic pregnancies before in our videos. You can go to our video library and then you'll be able to go through. But briefly, we can still talk more about this. Ectopic pregnancies do occur because of issues in the fallopian tubes. If at all your fallopian tubes are blocked with free fluid or even blocked with adhesions or tissues, this can be confirmed by doing the HSG scan, also known as the hysterosalpingogram scan. Then actually it can be worked on. If you have issues in your fallopian tubes, they can be worked on. The free fluid can be cleared, it can be worked on. So you should always get treatment. Remember, in this video today, we are talking about a faint line on a pregnancy test. Gerard Massa, the Health Educator, is the name of the channel. If you have any questions for me today in regards to a faint line, you have done the pregnancy test and the line is very faint, and you would like to know what is happening, you would like to get more information about this, you can ask your questions down below this video. I'll be able to answer your questions. And also, if you would like to go ahead and talk with me in private, you can actually go ahead and connect with me on my WhatsApp. It is +256 701 797876. That's +256. My WhatsApp number is +256 701 797876. That is +256 79 78 and 76. You can send me your questions, you can WhatsApp me your questions, and I will be able to answer all your questions. Ask your questions down below the comments section of this video. Faint line on a pregnancy test. Togedde ku bitka ebyenjawulo ebya pregnancy test, ne tugamba nti waliwo of course test je tuyita urine HCG, whereby tukebera omusulogo. Ne tugamba nti ate oba okoze test ey'omusulo naye n'obanga okyalinamuko akabusabusa ng'oyagala genda mu maaso okole test endala, tugambe nti osobola okukola eno ey'omusaayi gye bayita serum HCG pregnancy test. Doctor wo aba asobola okunnyonnyola, and then ne tugamba nti oba ng'okyalina okubusabusa ng'ate okyayagala okukola test endala okumanya oba oli lubuto oba toli lubuto, tugambye nti osobola okukola eno gye tuyita the pelvic ultrasound scan. Remember to ask me all your questions, and remember to come back for more videos about fertility. I welcome you on our channel. Thank you for sparing this time to listen to me, to learn something. I hope by the end of this lesson you have learned about pregnancy test, you have learned about a faint line, and you have learned that when you see a faint line, you should not worry. This is a confirmation that you are actually could be pregnant, but the levels of the HCG hormone, the levels of the pregnancy hormone are low. Or you could be taking some drugs, for example, antidepressants, and even drugs for anxiety, or even anti-allergies, drugs for allergies. And then you are at the same time doing the pregnancy test. It could mean that you are taking these drugs and they are affecting your hormonal levels. And then also it could mean that you could be having some issues, some diseases, or some hormonal imbalances, whereby you are ending up with high levels of HCG or slightly high levels of HCG, and at the same time you're doing the pregnancy test. The best way to confirm is do the pregnancy test for blood, or do the serum HCG pregnancy test, and then also remember you can go ahead and do the pelvic ultrasound scan. Osobola okola scan eno netulaga ki ekituufu ekigenda mu maaso. Faint line on a pregnancy test was our topic for today, and see you in my next video. Until then, may God bless us all. Bye-bye. What is infertility? What do we mean by infertility? In this video today, we are going to talk about fertility. We are going to talk about infertility. It's a common question that has been asked by many of our clients. So stay with us today. We are talking about fertility. Mu video ya fene ya lero tugenda kwogera ku topic ya fertility, oba okugezako okubanga oyagala okufuna olubuto naye ate nga okyalemeddwa okubanga ofuna olubuto. Tugenda kwogera ku biki kye bitegeeza oba kiki ekitegeeza bwe tuba tugambye nti omuntu ali infertile oba omuntu alina obuzibu n'okufuna olubuto. Gerard Massa, the Health Educator, is the name of the channel. I welcome you, my friend, and if it's your first time on this channel we talk about women's health, we talk about fertility, we talk about the ovulation calendar, and we do answer all your questions in regards to ultrasound scans. So when we talk about fertility specifically, this is when we are looking at the ability of someone, a couple, to have viable children, or to the ability of a woman to get pregnant. But if at all we are talking about infertility, this is the inability of a couple to get pregnant or to conceive after being together for at least 12 months. Okumala ebbanga ery'emyezi 12 naye ate ne mubanga mugezezaako okufuna olubuto naye ng'ate bibalemeredde, then kiba kitegeeza wandibanga mulinamuko obuzibu ne okubanga osobola okufuna olubuto, kye bayita infertility. There are two types of infertility. The first type is what we call the primary infertility, and then we have what we call the secondary infertility. What happens is that in primary infertility, a couple that has never had children before, a woman who has never got pregnant before, tries to get pregnant for a period of at least 6 to 12 months, depending on the age, and she does not get pregnant, or she fails to get pregnant. Whereas in secondary infertility, a couple has had a child before, but they take lots of time trying to get pregnant again, and definitely they do not get pregnant. So whenever this happens, we always advise that you need to go to hospital and then have yourself checked up. Tugambye nti mulimo ebika bibiri ebya fertility, tugambye nti mulimo ebika bibiri ebya infertility, mulimo ekika ekisooka kye bayita primary infertility and then kye bayita secondary infertility. Primary infertility kiba kitegeeza nti omukyala atazaalangako agezako okufuna olubuto naye nga ne bimulemererwa. Ate secondary infertility, omukyala yali azaddeko mulina omwana naye nga okumuzzaako bikyabadde ebizibu ennyo. On this channel, we do create awareness about fertility and reproductive health. Remember to submit your questions down below in the comments, and we shall be able to have a detailed discussion about pregnancy. Welcome to our channel, Gerald Massa, the health educator. On this channel, we do create awareness about fertility. We've already talked about that. Let's go on with our topic. So, one of our clients asked us a question, and she wanted us to talk about fertility, but specifically, she wanted us to talk about what could be preventing her from getting pregnant. We've said that when we look at the reproductive system of a woman, specifically, there are key things or there are key organs you need to understand. We have the ovaries, which are those round structures which are on the outside. I mean, they are just adjacent to each other, and these ovaries are specifically responsible for the release or for the production of mature eggs, also known as dominant follicles. And these mature eggs are the ones that go on and get fertilized. Normally, there's only one dominant follicle. I talked about mature eggs, or I talked about eggs because the ovary is responsible for the growth of many of them. But on the 14th day of your menstrual cycle, only one qualifies to be fertilized. We've said that also failure to get pregnant could be due to the fallopian tubes having issues. The fallopian tubes could be blocked, or there could be issues maybe to do with adhesions. Then also we've talked about the uterus, and we've said that the uterus could be having issues. You could be having disease of the womb. When we talk about disease of the womb, we are talking about specifically things like fibroids. These are swellings which may either grow inside, known as submucosal fibroids, and then they may grow in the middle layer of your myometrium or the walls of your uterus, and these we call them intramural fibroids. They may also grow outside your uterus. We call these the pendulated fibroids. So, in simple terms, failure for a woman to get pregnant could be due to, number one, ovary or ovarian dysfunction. Dysfunction is specifically the ovaries are not functioning well. Next, we've said that it could also be due to disease of the fallopian tubes. When we are talking about disease of the fallopian tubes, we are talking about things like hydrosalpingitis. In simple terms, water in the fallopian tubes. And then we've said that it could also be due to adhesions. And lastly, we've said that there could be disease of the womb. Tubadde tulikogerako biki ebisobola okubanga biviirako omukyala kulemerera okufuna olubuto, ne tugamba nti yandibanga alina ekirwadde kye bayita ovarian dysfunction oba ekirwadde ky'amagi. Amagi ge nga specifically tegakola bulungi, gafulumya amagi naye ng'obugivu bwa butini nnyo oba ne bukona naye nga tebusobola kubanga bufuuka olubuto. Tugambye nti n'enseke ziyinza okubanga ndwadde, ne tugamba nti n'abaana yinza okubanga ndwadde, era ne tugamba nti bino byonna bisobola okwekebejjebwa mu ddwaliro. So we have answered the question asked by one of our viewers, and specifically she wanted us to talk about the causes of infertility. It's a big topic. We shall proceed from here. We shall do it in parts. And remember, if you have any questions about fertility, you've tried to get pregnant, things have not worked out, you've taken all the herbals, you've taken the Clomid, you've taken all the drugs, but things are not working out. Probably you may need to get clarity on your system. You may need to get individualized care. We may need to have a detailed one-on-one consultation with you. You can ask your questions down below in the comments. You can also head to my WhatsApp and we could have a more detailed private consultation. And remember, you can talk to me free of charge. Consultation is free of charge. You just need to head to my WhatsApp. And lately I've been busy kind of, but now I've put I've spared some time at least to really handle my clients on WhatsApp. For those clients who've not been able to talk in detail on WhatsApp because of the busy schedule, I'm really so sorry. I apologize from my heart, but now there's more time for us to talk. Remember, we can get solutions to whatever has been preventing you from getting pregnant, free of charge. Just go to my WhatsApp. It is +256 701 7978 76. My WhatsApp is +256 701 7976. Gerard Master, the Health Educator, is the name of the channel. And until next time, take good care of yourself and may God bless us all. Bye-bye.